can get people, I would say 9 times out of 10, we're going to get people out of pain they're going to be able to do some sort of, dare I say, functional closed chain exercise, like a split squat, and they're going to be able to load it, and that's going to be pain-free, and we're going to be able to get some fatigue and some soreness in their quads. We're shooting for you coming back saying like, man, my quads were sore. I feel like I did a leg workout without leg extension, because that I'm a big, very much an anti-leg extension guy. I just don't think it's a good exercise, particularly for people with patellofemoral joint pain. I think you can maybe you can get away with it with ACLs, maybe you can get away with it with patella tendon people. I don't think with patellofemoral pain, most people are not going to tolerate leg extension, which is why I think probably why we've never done it, because we saw way more patellofemoral pain than we saw patella tendon pain, if you think about the spectrum or the range of athletes that we were working with. So.
All right. Hey, everybody. Welcome to episode 404 of the Strength Coach Podcast, brought to you by Perform Better, the experts in functional training and rehabilitation. Check them out at performbetter.com. All right. As you know, we alternate episodes each week. With 1 week, we have legendary strength coach, still strength coach, Mike Boyle. The other week, we do a guest strength coach. So I'm only saying that because you'll hear it in the interview. Coach Boyle gave me a hard time about just saying Mike Boyle and not just, like thinking he's not a strength coach anymore. So he's still doing it, everybody. He's still doing it, just so you know. Today, we talked about a tweet that was about patellofemoral joint rehab. And really, we got into a discussion about the role of the quads versus glutes. We also kind of brought in some hamstring discussion about that and how it relates to knee rehab, and then turned that into tight versus weak hamstrings, really for our clients. And we finished up with some conditioning for the youth athlete. Don't forget, guys, the Summits Chicago, June 12th to 14th. I'll be there hanging out. If you're going, come by, say hi. Long Beach, July 17th to 19th, and Providence, August 14th to 16th. Similar to last year, they're going to open up on Thursday, 3 business lectures this year. So from 3 different presenters, so that'll be cool. Friday and Saturday, all the lectures and practicals, kind of business as usual with that. But like last year, they're doing a networking room, so you can go hang with some of the presenters. Each room, each hour, they'll have 2 or 3 presenters in a room, and you could just go hang with them, just go talk to them, ask questions, or just talk about anything. So that's cool. Chris got a lot of great feedback from that last year, so he decided to bring it back. As always, the social will be on Friday night with my man Kevin Hirchin on guitar. There's a lot of new speakers, and they cut out Sundays, so it kind of makes it a little bit more convenient. Nice to get back there, get back home either Saturday night or Sunday morning. Guys, check it all out at performbetter.com. All right, hopefully you watched last episode with Pete Holman. We talked all about the hip, training the hip, and we incorporated using the glute slide. I do have a glute slide, so I had some questions for Pete, and I just wanted to get him on to kind of do an overview. And that kind of led us into talking about doing a 6-part series so we can show you. Obviously, we're doing the video podcast now. So just to show you some of the things you could do over the next 6 episodes with the glute side. So they're going to be 1-minute videos highlighting some of those things. So here it is.
Hey, I'm Pete Holman, inventor of the glute slide. If you missed the podcast Anthony and I did on the hips, one of the things we talked about is my latest invention. The glute slide is a slide platform that has a foot wedge to drive into and allows for big range, fast, smooth, and functional movement patterns. The push-pin resistance adjustment mechanism allows for on-the-fly resistance changes up to 180 pounds with our heavy Pro-Pack cords, and the handlebars provide stability for strength training or for safety during rehab-type exercises. We even have an adductor block that allows you to train the inner thigh or the growing muscles. Finally, the glute slide comes with wheels, so you can easily move it around the gym or store it at your convenience at the end of the workout. Over the next few strength training podcasts, we're going to be highlighting some of our signature moves on the glute slide. Until next time, get after it, everybody.
All right, guys, now it's time for the strengthcoach.com and NBC.TV Coaches Corner with Coach Boyle. Remember, strengthcoach.com, articles, videos, and one of the longest running forums in strength and conditioning and fitness. You can try it out for 7 days for free. Go to strengthcoach.com to start your trial. Also, NBSC.TV, where you're basically a fly on the wall at the NBSC staff meetings, there's programs, there's seminars, in-services from top coaches, and you can try that out as well for 7 days for free. Coach, how you doing?
I am doing great, Anthony. How are you? I actually have a bone to pick with you because
Man.
I was listening to your Pete Holman episode, and he said, yeah, every other week we have a strength coach on, and then we have Mike on the next week. And I was like, I think I'm still a strength coach. I don't know.
I gotta change my wording on that. Okay, on my intro. Shit, I didn't even pick that up.
I did. I was like, wait a second. I'm still a strength coach. I'm still working.
We have a former strength coach every other week. All right.
We have an old guy on, and the next week we have a real strength coach.
There you go. We have an old guy and we have a young guy. And young lady. Did you listen to Missy?
I didn't. You know what was funny is that
really good.
I don't know why. I think just the way it came up on my podcast app, Pete Holman came up first.
Oh, okay.
So I listened to his, but I haven't listened to hers yet.
Yeah, it's good. You'll like it. All right, Coach. I want to mention you do have the NBSC Spring Seminar this weekend coming up in Woburn at NBSC. David Gray is going to be there, among others. Pete Dupuy and some of the staff is speaking, as well as yourself. Mike, what is the weather going to hold up for this, or what?
Yes, the weather will hold up. Although we are getting some snow. If you're looking behind me, we are actually getting snow right now on Plum Island, but the weather will be fine. I do not believe the reason it's no longer the winter seminar is that we did not have good luck with the weather. I think 2 out of 3 years we had real disruptions where we had to cancel it, but where people couldn't get in, people's flights got canceled. So we moved it to the spring to avoid this, and we're still getting a little snow, but we're going to be okay. David Gray's already in the U.S. He's
I saw that. Yeah, I did see that tweet. Coach, there was a tweet about knee rehab. So rehab equals chasing quads, and long-term patellofemoral joint patients, they're ninjas at avoiding quad load, even during quad exercises. Never underestimate the body's ability to adapt away from load. Now, you really like this. You said your only 2 tweaks were you want to strive away from we strive for no pain, and we really like Spanish squat variations to decrease inset pain. But one thing a couple of points I wanted to talk about, because it was a thread for him. Beware underloading. So like body weight split squats, if they equal pain, add 15K to the chest, boom, quad burn, less knee pain. Some quads are begging for more load. I kind of found that a little weird, kind of a weird statement. He seems to want to stay away from the glutes. He said, watch the glutes. Some patients bypass the quad using the glutes like it's leg day at CrossFit. We want mostly a quad burn. I'm just kind of, my own personal experience with some knee pain, patellofemoral syndrome. That's what they called it back then. The first thing we did, he taught me how to get up from the ground because I was bartending and the bottles were underneath, on the bottom. And he showed me how to do a squat. This is in the 90s before I got into fitness. And he showed me how to use my butt. And I couldn't believe how it cleared things up. And we kind of really focused on the glutes that time, maybe a little bit of quad. What are your thoughts on this part of what he was saying with, quad burn and, not avoid the glutes, but be careful of it?
Yeah, no, I kind of agree with him. That's why I thought it was a good thread, to be honest, in terms of, I think, and the difference, it's probably things have changed now. When you think about the timing when you were doing that, there were probably more people not squatting. Squatting was kind of the fringe people squatted. Everybody else maybe they leg pressed, but they probably did leg extensions, leg curl, calf raise kind of thing. So I think it was a different time. Whereas now, I think what he's saying, and I agree with, is that a lot of people in rehab will learn to move and not really use their quad. So you've got to really get people, and this is where kind of the knees over toes guy, the one piece that he does have right is that backward walking, terminal knee extension kind of thing does get your quads burning. And what you really want to do with someone with patellofemoral pain is you want to get them. We always talk about the idea of asking people, where do you feel it? And I want people feeling it in their quads. It's one of the reasons I love, we made our, like with our ACLs, we make our ACL people ride the hell out of the assault bike. Because when you do things like half miles and miles on the assault bike, not only are you getting a conditioning effect, but you get off that bike and you think, oh my God, my quads are massive. I've got so much blood in my quads right now from that usage. So I thought that was a reasonably good, solid point when you're talking about people with patellofemoral pain. Usually what you're going to find 90% of the time is someone with a lot of quad atrophy on that side, or people with no quads at all. Like, it's crazy. Sometimes you'll look, particularly like you get patellofemoral pain tends to be a lot more young females, and you'll look at patellofemoral pain young females and you'll think, my God, they don't have any quads at all. Most of them, you'll look and think, okay, this, they've got some glutes, they've got some hamstrings, and they've got very, very little quad mass. So I didn't think that was bad. My bigger bone was, I don't like even when people say, oh, we're okay with 2 out of 10 pain or something like that. That's why I mentioned the Spanish squat idea. We usually can manipulate the direction of loading. Either we can load anteriorly, sometimes we'll load kind of with a curl bar, easy curl bar off of the low pulley, and create more terminal extension on the split squat, or we'll Spanish squat and create more terminal extension on the split squat. And usually we can get people, I would say 9 times out of 10, we're going to get people out of pain they're going to be able to do some sort of, dare I say, functional closed chain exercise, like a split squat, and they're going to be able to load it, and that's going to be pain-free, and we're going to be able to get some fatigue and some soreness in their quads. Like, a lot of times, that's what I'm telling people for. We're shooting for you coming back saying, like, man, my quads were sore. I feel like I did a leg workout without leg extension, because I'm a big, very much an anti-leg extension guy. I just don't think it's a good exercise, particularly for people with patellofemoral joint pain. I think you can maybe you can get away with it with ACLs. Maybe you can get away with it with patella tendon people. I don't think with patellofemoral pain, most people are not going to tolerate leg extension, which is why I think probably why we've never done it, because we saw way more patellofemoral pain than we saw patella tendon pain, if you think about the spectrum or the range of athletes that we were working with. So
yeah, you kind of answered 2 of my other questions. One was that idea about, he did say a little pain is okay. So you would say like a 2. So that was like, I was like, ooh, I don't think Mike's gonna like that.
That part I don't like that part, because I think you should be tweaking the exercise, trying to figure out, is there a way we can eliminate that pain? Like, if I get you to, sometimes it's Gray's RNT idea. Okay, I'm going to pull you into a little bit of valgus and get you to recruit your glute a little bit more, and maybe that's going to take your patellofemoral pain. Or I'm going to get that Spanish squat hook up, and I'm going to get you to get more terminal extension kind of force, and that's going to take your pain away. I think if you tinker enough in the beginning, you will find a way to zero that person out, and that's what I want to do.
It's funny that you talked about atrophy. So I'm living in New York City at the time that this happened, bartending in the 90s, and I lived on the 4th floor, and so I had to walk up. It was a walk up. So I used my left leg to walk up. The reason why I finally went to the doctor, when you're in your late 20s, you're not going to the doctor. I was like, oh my God, I have no muscle in my right quad. It was embarrassing. It was like the size of my arm. I didn't realize how much it atrophied. That forced me to go to, start getting some rehab. And but I will say, this time around on my meniscus surgery 2 years ago, one thing I did, every therapist, talking to you about it, as well as the orthopedist, bike. I biked for 6 months before that surgery like a madman. And then I did your whole, just for the month before surgery, the Airdyne programs you have, I just kind of did all of those about 4 times a week. I went crazy on that, and I really felt like recovery was so much better, because bike just felt great. There was no problem at all on the bike, and I felt like my quads were, and I was doing some Spanish squats too, based on your information.
Yeah, that's and I think honestly it works. It's worked for us with our ACL people. It's worked for us with our patellofemoral people. It's worked. Like we can, and it's gotten better, but patellofemoral joint pain used to be like almost an epidemic with young females. You would just see it from so much just overplaying. If you saw whether it was soccer or basketball, or you kind of get these tournament kids who are doing so much on the weekend, and they're just in constant knee pain. And we got pretty good at treating patellofemoral pain. But interestingly, I think because again, we don't have a huge basketball clientele, we didn't see as much of the patellotendinitis crowd as we saw patellofemoral pain.
Mike, let's segue this into hamstrings. There was a thread on strengthcoach.com about tight hamstring clients. I want to get to that in a second, but let's stay on the knee thing with hamstrings. How much do you work on that? Like I really did think of the hamstring, or the walking backwards, as well as kind of a partial hamstring exercise as well, besides the quads. How much do you focus on the hamstrings when you're looking at dealing with some of these rehab patients?
A lot, only because it's so funny when I think of the things that sort of resonate or repeat in my mind. I can always remember Gary Gray, attack the hip, attack the hip. If you've got a bad knee, just attack the hip. Let the knee calm down. Don't worry as much about the knee. So we were always big on attacking the hip. And when you attack the hip, it's hamstrings, right? I mean, it's hamstrings and glutes, but I don't know if you saw, I did that Twitter video that I put up in terms of, we probably do more hamstring work now than we've ever done. We're doing Nordic isos or Bosch isos or whatever you want to call them, not Nordics, but just sort of hovers, hang out, hold for 5, come back, hang out, hold for 5, come back. We're doing hip extensions. We're doing hip lifts. We're doing one leg straight leg deadlift. If you get somebody who's got knee pain and we can't get them out of pain, they're probably going to do 3 or 4 hip dominant exercises as we let that quad calm down. And then we're going to try to figure out, can we at some, when can we get back to whether, and it might be bodyweight Spanish squat. It might be a bodyweight bilateral Spanish squat. A lot of times I've found that's the first thing somebody with patellofemoral pain can do, because they're able to kind of shift the load a little bit left to right or right to left, depending on what they need. When I had my meniscus done, one of the things I noticed in the beginning was that I could bilateral squat, but I couldn't split squat in the beginning. And then at some point I realized, okay, I can split squat. Split squat feels fine. So that's where sometimes you look at someone like me and I think, hey, I'm fine with bilateral exercise if I need it. I'm just not, I'm going to get to a point fairly quickly where I think I don't need it anymore and I'm going to go back to unilateral. But I'm particularly with those early rehab people, I get no problem with, again, much like the bike, we can do lots of bodyweight squats. We can hammer somebody's glutes and hamstrings with hip extension type of stuff. We can get them on the bike and really finish off their quads in a way that allows them to maintain some fitness at the same time. So I think that's probably why we have such good results with our rehab situations, because if nothing else, we've been down the road over and over again with people, and you do get a relatively strong sense of, hey, I know this works. I know this formula. And I think, the Gary Gray attack the hip thing, that goes back to Cam Neely in the 90s. I remember, listening to Gary, and he was like, you want some pain-free quad work, and then just attack the hip. Keep attacking the hip. Feed, he was like, let it move, let everything go down. And even now, you look at kind of David Gray stuff and you think, attack the foot, attack the calf. There are all these other things that you can do where that knee is right, just trapped in the middle, but you're not. And that's why I hate leg extension, because leg extension, literally the knee, that's the middle, right? It's the center. And that's what people tend to not tolerate well, in my experience with knee pain. So that's the thing we don't do.
And so my question on the tight hamstring thread, first, you guys, I know how much you hammer home the hip extension exercises, et cetera, hamstring. Do you ever now, with your people that have been there for a while, are they ever complaining about tight hamstrings? Because here's my thing. People come to me at the gym and they're always asking me, oh, I feel like pulled my groin or my hamstring is tight. What should I do? What stretches should I do? And I'm like, no stretches. I mean, you pulled it, I think, because it's not strong enough. So do some exercise. And people have come up to me like, oh my God, I kind of took your advice. You started doing that, blah, blah, blah. And I feel so much better. I feel like with you guys, you're probably not getting anybody who's sitting there that old, hey, my hamstrings are tight, so my back hurts, that typical kind of back in the day. But I can imagine.
We very, very rarely see that. We will stretch our hamstrings,
Of course.
part of our stretching, but I always say, and this again, you do think about the things that stick in your head. I remember Pete Friesen saying to me, had to be 25 years ago. The one thing you never wanted was someone who was really loose in one plane and really tight in the others. And he was talking about hockey because we had some guys who they could almost like do a split. So, their adductors were super, super flexible, like a V-sit type of split, not a conventional split. But their hip flexors were really tight. He said, those are the guys that have problems with their hips. He said, they've got really tight hip flexors, iliacus, psoas, and really long adductors because they're constantly stretching their groin, quote unquote. He said, those people have trouble. So one of the things that we started doing right off the bat, we always said to people, you have to stretch your hamstrings, you have to stretch your hip rotators, you have to stretch your adductors, you have to stretch, equally. Like, we're not going to do 10 adductor stretches and no hip flexor stretches. We're not going to do, 5 hip rotator stretches and no adductor stretches. We're going to try to think about going across the spectrum a little bit more with everybody and realize that, we want quads, we want hamstrings, we want hip rotators, we want adductors. And if we do that, we're going to generally end up with people who get pretty healthy. In general, we've probably moved beyond the old, oh, your back is sore, stretch your hamstring thing. And that was because we say your back was sore, okay, strengthen the front, do more crunches, do more sit-ups. We know that's not true. So I think in much the same way that we've gotten better at dealing with patellofemoral pain, we've gotten much better at dealing with low back pain. Because with most people, and it goes back to them again, I'm clicheing to death here today, but McGill would always say, spare the spine, right? You get somebody with a bad back, what do you want to do? Spare the spine. Don't be moving their spine around. Don't be doing cat-cow and rotation and, 90-90 and all this stuff. Get them to develop some stability. Get them to be able to move their hips. Get them to be able to do bird dogs and dead bugs and stuff like that, and be able to keep that back from moving. And what happens? The back calms down. You develop strength and mobility around the hips, and suddenly that person is like, oh, I don't have back pain anymore. Because what they were doing is they were compensating, right? They were using their back to do other things that the back really wasn't made to do. All we wanted to do, hey, get their glutes going again, get their ass to come back. Because again, I've done that talk a million times, and I always said, go walk around the mall, right? And really walk around the mall and look at adult males and see how many of their pockets of their pants are literally on their hamstrings because they have no ass. Like, you'll look at a guy and think like he has no ass at all. The bottom part of his pocket is covering the top part of his hamstring. Whereas if you look at someone who's got an ass, like their ass, like that pocket is on glute max. Like, there's a glute max there. We have got no glute max anymore in this country. We have it's men, but it's not really glute men because it's not max.
I got to check my pants here. I have a client. He's actually my accountant too. He whenever he has back pain, he's a golfer, so we'll do some different, med ball throws and all this thing. And I always say, nope, we're not doing that stuff today. We're going to keep as stable as possible. We're working stability. He always leaves feeling a little bit better when we're doing those type of things where it kind of, I feel like, that activation word is taboo, but I feel like when they feel a little bit more activated around that core, the glutes, and then they feel like, cool, I feel like a little safer almost. Cause back pain can be so vulnerable. People feel vulnerable with that. And he feels like, okay, I feel like a little stronger. I think the anti-rotation can give you that feeling.
Yes, and it's funny because we've talked about this the same way. The people, the kind of anti-rotation people, but I don't think there's anything wrong with doing stability work. In fact, I think there's a lot right with doing stability work because we're not, and that's more cliches, right? Alan Cosgrove's overreaction, underreaction. There's always kind of an overreaction in the short and an underreaction in the long term. And That was that way with core stability. It was that way with core activation. I said, we were talking in the staff meeting today, and I said, dead bugs. We were talking about dead bugs and leg lowers, and I said, as much as I hate to say it, they really do work on core engagement. What we're trying to do is get somebody to understand, because we talked about the idea in most of these core stability exercises, the movement is a perturbation. It's designed to try to say, pull you into extension. And what do I want to do? I want to recruit my deep abdominal muscles, my anti-extension muscles, and get them to work. That's not a bad thing, but then you see the videos of people walking around like robots, and they can't pick stuff up and they can't sit on the toilet because they're trying to keep a stable core. And it's like, that's not what we're saying. It's just that during that exercise, like an anti-rotation exercise, the point is anti-rotation. The point is not in a day-to-day life skill. Hey, I want you to never move. I want you to keep as stiff as you possibly can and walk like you got a freaking broomstick up your ass for the rest of your life. That's not what we're trying to do. But there are going to be exercises where that is exactly what we're trying to do. And so I don't think it's any different than squatting. If someone said, oh, I'm going to walk in and go to the bathroom, and you were like, okay, shoulders back, get ready, lower yourself down. I mean, you're not going to do that, right? But that's a squat. Like, it's no different. And you just you've got to get people to be able to distinguish between movements and life skills, and realize that sometimes we're teaching exercises that aren't life skills. We're not saying to somebody, I'm trying to teach you how to become immobile and not move. So
Yeah, I'll be honest too. You got to worry about it sometimes when you're like, I was training a golfer this week and going over the pelvic tilt, anterior, posterior, anterior, posterior. Give her some awareness of it, right? And then in the golf swing, it actually happens, the posterior tilt. She's like, well, when am I doing this in the swing? I'm like, whoa, 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 whoa. Jason Glass always would say, what happens in the gym stays in the gym, right? I was like, no, don't worry about this. I'm trying to give you the ability to do this. No golf pro's ever going to tell you to pelvic tilt. It's just something that happens. I don't want you to think about it. It's like breathing. So yeah, you're right. You got to be careful with some of these things where they think this is how I always have to do it.
Right. And that's part of the problem, because some people do overdo or overteach those aspects. And suddenly you do have people who are thinking, wow, I need to, I always thought during a sports school, you don't want to think at all. There's nobody who's good at a sport who thinks about what they're doing. There's nobody who gets up to hit a baseball and starts thinking about, I wonder what I think I gotta, I gotta load my hip, and I gotta think about what it's like. No, somebody's throwing a 100-mile-an-hour ball at you and you're trying to hit it back the other way. It's just happening. But that doesn't mean don't train. That doesn't mean don't work on some of these patterns. And it's the same with the golf swing. You want to give somebody the degrees of freedom so they have a better swing, right? If they have the ability to internally rotate and externally rotate their hips, and they have thoracic mobility, that's going to carry over into their golf swing. But you're not thinking about that. You're not teaching it, and that's every sports skill.
Yeah, Mike, go back to really quick anti-rotation. It's funny because I thought about you this morning. My wife and I were in a class in metabolic. We have a metabolic that just opened up, so we joined together so I can get her going. And the guy was going over exercises, and one was a side lunge with a Pallof press. Now, we know how Coach Boyle loves the names of exercises, but this one you got to give a little bit. I mean, John Pallof is at MBSC, but do you call it? I call it belly press.
Yeah.
What's that?
Anti-rotation press. Just
exactly. Mike, do you still use that? You guys still using that? And the landmine rotation exercise?
Not the landmine as much,
Okay.
but the Pallof press / anti-rotation press, yes. And more so as kind of a beginner remedial level core exercise. But yes, I think we're always trying to sprinkle some core in between what we would consider the majors, the pushes, the pulls, the knee dominant, the hip dominant, and then we're going to have usually there'll be some type of anti-rotation core, some type of anti-extension core, some type of anti-lateral flexion core that's going to be in that program. That stuff still stays, but again, depending if we've got 2-day-a-week people, less of that than
Yeah.
there. It's more, you kind of, again, back to the cliches, right? You don't want to major in the minors. You want to major in the majors. So we're gonna make sure we're thinking more about did we do a push, did we do a pull, did we do a knee dominant, did we do a hip dominant, and then if we can sprinkle in a couple of little core things in there, then we're going to.
Yep. Mike, just made me think about something really quick. Last one, conditioning. I was a thread on the forum. I'm like, Mike's going to have a heart attack on this one. Conditioning 8 to 11 years old. I know you talked about playing games.
That must have been new. Was that today?
Yeah, I thought you answered it.
Oh, maybe I did. I might have.
Yeah, you answered it, and you were talking about kind of just playing some games with them, right? That's really what you had said to him was basically, look, some tag, etc. Kind of very a la Jeremy Frisch type stuff that we know Jeremy likes to kind of throw in there, and almost like you were talking about sneaking it in, right? That piece of it. And for me, I was like, yeah, conditioning at that age, wow, that doesn't seem like something we want to do, like, or we should even have to worry about. I know kids don't play as much, but when are you really starting to think, okay, you're doing air done, you're doing intervals? What age is that? Is that when they come in at 12, or what's your thoughts on that?
I think 12, and I think I've said this too numerous times in the podcast. We're doing less and less conditioning all the time because
Yep.
the kids are doing more and more stuff outside. When we started Mike Boyle Strength and Conditioning, I would say if it was a kid who was a hockey player in the off season, he might have had one practice a week. Off season, it's not hockey season. He might have gone to a skill session. We have kids now who don't have any off season at all. They're probably involved in 3 sports, all of them overlapping. I can remember going through it with Mark and Michaela, and I always say that was really good for me to have my own kids and go through it and realize Mark, when he was, say, 12, 13, 14, a typical week in the fall would usually be at least 2 hockey practices, at least 2 hockey games, usually 1 lacrosse practice and 1 lacrosse game. And so I'm looking at that and thinking, he's got 5 conditioning, cardiovascular exposures. If we think about that Dan Baker quote that I love so much, Dan's always like, a lot of those exposures kind of at long, slow distance kind of rates. They're just, you're out there for an hour. Nobody's bagging you. It's not Herbie Brooks, making you go board to board, but you're moving around for an hour and you're doing that 5, 6, 7 times a week. That kid probably needs speed work and not conditioning. So I think that's you've got to make everything really context specific and look and say, what is this kid doing? It's when you don't do that kids start to get hurt and you start to see kids with adult injuries. All of a sudden you got kids with sore backs and sore groins and sore knees. And usually what you look at is that kid's overscheduled. That kid's we had kind of our rule was, generally speaking, 1 thing a day. And the only times we doubled up were on days that we lifted, we would lift and then go to hockey practice or lift and go to lacrosse practice. But on those days, they would never do any conditioning at all because I always knew that, we want to get our strength work in, our speed work in, our power work in. And then they'll go and get an hour of exposure of running around. So
yeah.
I think that's what you've got to look at is what's the context with these kids? What else is going on during the course of the week? And I would be willing to bet if you're talking about at least, I got to say, anybody in the U.S. really, they're probably involved in at least 1 sport a season and usually 1 or 2 that are going to overlap each other.
Yeah, it's interesting. I've been monitoring my stick time, right? Stick time is just you go out there, right? Stick and puck. You just do your own thing, unless, maybe you have some short-sided games or you have a friend there and you're playing. If I don't think about it, I am in zone 3 and a little zone 4. If I play a short-sided game with the kids, and I'll last 12 minutes, and then kids, I'm holding in your parents, I'm out of here. Then I'm mostly zone 4, a little zone 5. And if I specifically think about it and say, okay, you haven't done any sprinting or gotten the heart rate up, let's go, let's do some Herbies, right? So it's amazing to your point about how high the heart rate really does get up. I see these kids playing just at stick time, it's at stick and puck, playing half ice with each other, and they're doing it for 25 minutes. Their heart rate is just even that. And that's not even a coach. There's no coach out there. There's no anything. So they're definitely getting that exposure. And these kids are playing spring league now. Then they come to stick and puck for their own enjoyment.
Well, I did it 2 years ago. I took a bunch of the kids that Mark and his friends that were going to be freshmen lacrosse players. And because I was worried that they might end up having to do some kind of running test. They might have to run a mile. They might have to run a mile. So we went every Friday and we just ran a mile. And they were all able to run a 6-minute mile without having done very, very little running. And not that that's unbelievably good, but you're talking about, we had done no specific conditioning at all.
Yeah.
And they all busted out probably between, 550 and 610 in the mile the first time that we did it.
It's amazing. I think it's pretty damn good without specifically.
Without no training,
relatively
speaking.
Yeah, very cool. All right, Coach, we'll let you go. This has been, I think I started counting around 3. I think there was 5 cliches, but we're going to count. I might have to throw that in the title. So the cliche episode.
Cliche fest.
There you go. Thanks for doing this, Coach, and we'll talk to you next time.
All right, thanks. See you, Ant.